Morning, everybody. Not feeling well, but yeah. How do you guys want this to happen? Last time we had a discussion over this. It took us a lot of time. If you want a monologue or a dialogue, I'll decide based on that. How many wants monologue? 2, 3, okay, 4, 5, 6 monologue. Dialogue? Okay. So, lot wants a dialogue.
If we do like, you present an overview first and then we switch to a dialogue,
Yes.
it will include more people.
Alright. So, whenever you have a question, please raise your hands and yeah, that'll be easy. So, welcome to DAOs, Decentralized Science. There were some predecessors to DAOs, Open Science and Meta Science, which tried to fix certain things in traditional science. But before we go into DAOs, let's get an understanding of why DAOs is needed at this moment. So first is decline of disruptive science. So if you look at the kind of disruptive science discoveries that we've been making since 1940s, there is a huge decline in that. And this was recently published in Nature, I think in 2023. If you look at life sciences in specific, it flatlined somewhere around 1995, and then we have been not bringing up a lot of disruptive discoveries into biosciences. So why is this happening? There are some systemic problems within traditional science, and let's figure out what these are. So first key factors in traditional science that I want to expose is, one is funding. Funding is highly competitive and asymmetrically distributed. So the funding agencies decide which areas of research gets funded, and it is very asymmetric in this case. It's not equally funded in all domains. And most scientists would change topics and fields if funding was not a concern, and we spend too much in time for applying it. On an average, a scientist spends 3 to 6 months of his time in writing grants and applying for fundings. And the next crisis is replication. Much of science is not reproducible. The problem is that all the data goes into silos, and there is no open data sharing, and there is no incentives for sharing negative results. And then the third one is competition. Science has become hyper-competitive, creating perverse incentives. And if you look at life of a young academic, it is highly stressful because funding and publishing goes hand in hand, and this pressure kind of trickles down to the lower section of academia, where PhDs, postgrads, undergrads have to bear this pressure of publishing certain amount of articles within a year. So then comms. So this is very important in my case, communications, because who funds science? Citizens fund science, basically. If you look deeper, citizens pay taxes, and this tax money is converted into funding. And we have no way to create a dialogue between the scientists who do science and citizens who are the end users of science who also fund science. So there is no dialogue happening. And this is one reason for misaligned incentives. And so let's look into this valley of death, which is the pharma side of science, and then we'll also look into academia side of science. So if you look at pharma, an average drug development costs more than $2.6 billion US, and it takes 12 to 15 years for one drug to come to the market. And what you're seeing here as percentage is the success of leads that are translating to the next section of these trials. So I guess we have gone through this already several times throughout this week. What is interesting to me is this valley of death, which is there is a huge translational gap in drug discovery process, and there are some culprits leading to this translational gap, or the valley of death. One is poor hypothesis, irreproducible data, ambiguous preclinical models, statistical errors, influence of organizational structures, lack of incentives in academic setting, governmental funding mechanisms, the clinical relevance of basic research, insufficient transparency, and lack of data sharing. So all of these are like some of the culprits which leads to this translational gap or the valley of death in pharma. And this is where DeSci come into play to kind of fix this. And as I said, the bridge is broken between the citizens and the scientists. So imagine if you have a problem, call it hair loss, for example. It's one tangible example. So if you have a hair loss issue, no government agency is going to come and fund hair loss research and big academic projects. So even though if you have money, even though if you have capital to fund these sort of research, you cannot drive invention because there are gatekeepers. One, governmental funding agencies, two, big pharmas, and then three, VCs who kind of invest on these scientific domains. So there is a huge disconnect here between two integral parts of scientific process, the end user and the value creator, the supply and the demand. So for people who are not from academia, this is how academia works, and this is something that we are currently trying to solve in academia. We started with this goal: scientists should do science, and they should not be spending time in writing grants and writing proposals to get funded. So this is how it starts. So a scientist would start with writing a grant proposal. If the topic is hot, he'll get funded readily. And if it is a moonshot, no funding, go back, write a new proposal, try to figure out, and then if you get a hot topic, again get funded. So this takes more than 1 year, I think close to 6 months to get a project funded or approved. And then the next is to deal with bureaucracy. And even if you do science, the scientists are not involved in this IP creation process. So inventor would not have a ownership over his IP, but some sort of licensing over his IP. So that is one problem. And then the next big step is to write and publish papers. If you have enough citations, you can move up the ladder. You can apply for more funding. If you don't have enough citations, leave academia, go to industry. So this is how current academia works. And here is what we are trying to solve this. So this is one example of how DeSci works in real life. So you guys heard a talk just before this, I think, from Aubrey, yeah? So Aubrey's RMR2 is going to be listed here. So it's currently in the pipeline. And let's look at this project, antibodies for Alzheimer's, which is one of my favorite. So what you're seeing here is a project name and the PI who is going to do this project and the university involved. And there is a whole list of information that is needed for a funder to decide whether to fund this project or not fund this project. For example, research impact, summary, problem, solution, commercialization potential, and how they want to use this funding. And you have further docs where you can see the pitch and all of this, like proper evaluation, due diligence, and all of this. So what does 78.834 ETH calculates to? Somewhere around 250K US dollars in funding. And so how this funding works is you put up a project with all information that is needed that you want to communicate to the citizens or like common people, and then they decide whether to fund this project or not fund this project. If the project is much appealing, if you have it in an accessible language, people are going to fund it. And once this is done, we are going to help negotiate with the universities how to transfer this fund into fiat money. So you get like proper currency, if you're in India, you get INR, and you can start doing research based on a sponsored research agreement, like how any industry would come and sponsor a research agreement. Interesting record here is, so the project Percepta, which is for boosting mental health, like sort of a memory supplement. The project goal is 127.7 ETH, which is around 500K US dollars. And can you guys Guess how much time it took to fund this project? Any numbers? Go on. Random numbers. Some other?
A week.
A week? A month?
5 minutes.
5 minutes? Okay. 6 minutes? Go on.
10 seconds.
10 seconds? No. So it took 60 minutes to fund this whole project, $500,000 US. And the project's been negotiated quickly, and then the researcher received the funds, he's doing the research. And what does a funder gets in return is a token that tells them, okay, they funded this project, to tell them, okay, they have this. They don't own it generally, but they kind of say, okay, I funded this project. Because people generally want to, what we are providing to people through this sort of system is power to control science, right? Which they never had. Even though they had capital, they never had power to control scientific projects. And that's what we are providing them with this sort of model. And yeah, please.
Was it a few donations or more distributed?
It's distributed, but there are like some big players as well. So it's open, like anyone can come buy into this. I'll go into BioDAOs, which are like big brothers in this DeSci ecosystem, because BioDAOs have a certain goal and certain specific area that they want to focus on. For example, there is a BioDAO for hair loss research, there is a DAO for women's health research, there is a DAO for longevity research. So there are different DAOs which work on specific causes. What are DAOs? So DAOs are communities within a community. So there is a community of scientists, there is a community of Web3 devs, builders, funders, citizens, and patient groups. So they all come into one organization, which is decentralized. No central authority is there, and it is completely autonomous. The community decides on all decisions. And this is basically decentralized autonomous organization. And what sort of power we get in this sort of community structure is that you get to fund projects that really make sense for the community. Let's say for people who are into Vita or longevity science, if they want to push longevity science in any different areas, they get to decide, they can vote on the proposals, they fund research they want to. They can incubate, they can spin this out into startups or license it to the big pharmas, or they get to decide what to do with the projects. And this is how a BioDAO's value creation model works. Basically, you are getting, so let's start with universities. So you pay universities to get access to the IP, right? And this IP is not completely owned by the DAOs, it's a shared ownership between the inventor and the DAO. And the DAO as a community owns the IP. And then you can use this IP to outsource it to a farmer, to bring it to the market, and you get money in return, and the DAO fills its treasury to fund next set of projects with universities. And for communities, they sell IP tokens, which is like representation of that you paid for this project, and then in return, you also collect liquidity to do more projects. And then you can also work with corporates, companies to build more products by paying them dollars. So this is how a BioDAO works. It integrates all different players of pharma, and then with that you can drive innovation. So these are some of the BioDAOs in the ecosystem. We have CryDAO for cryopreservation, Athena DAO for women's health, Vita DAO for longevity, Cerebrum DAO for brain longevity, Valley DAO for synthetic biology and climate tech research. There is Hair DAO for hair loss, Psi DAO for psychedelics research, and Quantum Biology DAO for quantum biology. And yeah, so the next evolutionary step for DeSci is bioacceleration, which is basically where engineering, we engineer biological systems and we democratize this process. That is what we call biotech acceleration. So the main trinity, or like the main pillars of this bioact processes, crypto, AI, and biotech. Once we see seamless integration of these three technologies, then the Bio Act kicks in. So we want to mainly do mainly push into open source biology, where there is open data sharing, and there is a collaborative innovation. There is no barriers between, no demographic barriers or technology barriers, and then you create open source biology. And then next is supply chain revolution, where you do localized production and reduce cost and time for this sort of scaling up of different technologies. This is what we are aiming with BioAct, which is traveling towards biosingularity. And it might be a little difficult to read, I can read it. We start with personalized medicine, AI-driven protein design, synthetic biology, whole genome synthesis, decentralized biopower, environmental restoration, xenotransplantation, neuroengineering, ethical evolution, post-scarcity biology, human augmentation, biocomputing, open source biotech, biological computation, biodigital fusion, bio-nanotechnology, synthetic ecosystems, mind-body liberty, and then biosingularity. So this is what we are traveling towards. Maybe I can read like few lines from our BioAct manifesto, which is open for everyone to sign. Yeah, this is the last thing. I just want to read like few lines. The future belongs to the open, the distributed, and the emergent. It belongs to all of us as co-creators and co-evolvers of the planetary meta-organism. So let us go forth and hack the biosphere, not as conquerors, but as symbiotic partners, lest we fossilize within it. Let us code new cures, spawn to systems, not in the service of greed, but in the pursuit of civilization and flourishing. Let us make the Anthropocene era not one of human dominance, but of a human biosphere collaboration. The choice is stark: evolve or expire, rage against the machine, or replace yourself with one. For too long, biotechnology has been an extractive industry. It's time to make it a generative one. It's time to reanimate the bioscene with the spirit of punk audacity. It's time to upload our evolutionary source code from wetware to software to dreamware. The future is fermenting. We are the yeast, beast, and biohackers. There is no fate but what we make, evolve, and transcend. That's it. Thanks, guys. I'm open for questions.
Yeah. All right.
Yes.
So before we go to questions, every time Kishore has given this talk, we've fallen into a huge discussion where it's a lot of points that doubts people have about TradSci. So can we first take the doubts that you had during the presentation, where you thought one of the concepts is something that you did not understand? We can help clear that up for you, and then we can move into a more evolved discussion on how we can use some of these mechanisms to accelerate science in India. Specifically get some feedback on the traditional scientific ecosystem here, and then move from there.
Sure. So this is very specific to the DAO system. Is there any success story for Indian university system with the DAO? Especially in a public funded university system.
DAOs collaborating with Indian universities.
Yeah.
So I worked for one of these DAOs, Valley DAO. So we kind of had a couple of projects from Indian universities for biomining, specifically from IT Madras, I guess. But it was a competitive funding round. A university from Australia won this funding, so it went there. But we of course onboarded projects from India as well.
So I think, just to add on there, because remember, in the Indian university system, when funding comes, traditionally Indian universities, they take up funding from government.
Yeah.
There's a layer of things once money comes into the university system. And on top of that, there's a lot of regulatory as well as, bureaucratic hurdles.
Yes.
I'm not sure how this is going to pan out once, as a scientist, if I won this one, and now chance to convert this into the INR. That is going to be one of the issues, especially considering how government sees the crypto.
Yeah.
Kishore, can I take that?
Yeah.
So I work with a now for women's health, and I have for the last 1 year I have been working with some of the scientists across the country who wanted to submit projects, and they have a similar question, which is why the philosophy that scientists should get funding in either dollars or INR has been the goal for any DAO. So what we do is we work with partners who off-ramp the money for you. You don't see the light of crypto at all. You get the money in INR where you don't have to deal with crypto. It's just a model for raising funding where the money is being raised in crypto, but what the scientists get is either INR or US dollars. So some universities which have the ability to, the capability of accepting US dollars for funding, that can be done directly. But there are partners that I've spoken to who are ready to do the conversion into INR and then give it to the university. One other challenge though is that some universities do not accept foreign investments. So that's something that we might have to.
So that's what I was coming on. Best way would be to create a network, do the MOU across these universities, or approach a UGC. We have a very progressive, leadership in a UGC. He will definitely going to understand it. If you need a help, we can definitely, facilitate that. But that kind of a thing is going to make it more easy. As a scientist, I have not to worry about once I get my funding, how I'm going to spend it. Because it's a challenge in, at the practical ground level. Getting a funding is not a problem. Sometimes transferring that money is a problem. Once you get that money, spending is another problem. And these projects are going to be very timeline dependent, milestone based dependent. I will give you one example. I had to, and I'm talking about JNU, which is a premier institute of India, very progressive. I had to buy equipment which is like 40 lakhs, and it has been 5 months since file is just moving from one place to another place. Everything has to go through GEM, which is in itself a problem. There's many things happens. So even if we will be able to get that fund, we won't be able to complete it at the time, which is going to reflect badly on the system. So before moving to that part, it's better to iron out these creases so that we don't run into the trap.
This will more look like a sponsored research agreement. Let's say there is a startup or a biopharma company who wants to do a collaboration with a professor in the university. They're going to transfer some funds for a particular part of the research, and this is how this contract would look like. It's not a grant in itself, it's a sponsored research agreement. You get a certain amount of money, there are milestones to be covered. And
it's not that easy. And theoretically it looks pretty easy when things has to move from one desk to another desk through a clerk. It's a huge problem. And moreover, a lot of universities, governance, they are very, very much not aligned to take the foreign investment. This is going to come as investment. So those are going to be the question which we need to answer before moving.
True.
And by the way, I will be more than happy to, try this out and create some kind of a pipeline which can be utilized by some other universities.
Yeah, we've been working with different universities, and each universities have been a case-by-case, unique basis. For example, University of Zurich, we have struggled, and then we were not able to negotiate because of the bureaucracy. They agreed to it before fundraise, but after fundraise, the process is taking too long. We have a limit of fundraise, negotiation, 180 days. If we could not reach the deadline, we have to transfer the funds back to the funders. So, it's been difficult, but we do it case by case basis, trying to standardize if there is a possible way. But just to know, all of this takes place in a normal legal condition. There will be contracts involved, there will be legal enforcements, and all of this. Just fundraising is through crypto. The rest all takes a conventional pathway.
They will ask you the source of money too.
That's where DAOs come in. These are legal entities, so they pool in the funds as a legal entity. And again, foreign investment could be another big hurdle. We might want to build some sub-DAOs in India itself, registered in India. But again, there are issues with legally wrapping DAOs into a legal entity, which only some countries allow. Switzerland, Marshall Islands, and with India, we need to still.
Can we go back to like DeSci before going? So let's come back to the DeSci concepts first and address some questions in that if anybody has. Then we'll move on to once the funds move out of the BioDAOs and are moving into the institutions, because that side is something that we're also still figuring out. It's a conversation between universities and the DAOs.
Because I was director of research and development for DNU for 3 years. We tried very hard to decentralize, make these things very easy. But in the government system, unless it comes from top-down approaches, won't work.
Yeah, you had a question. Anyone else has questions or feedback on the DeSci mechanisms?
So I was trying to understand when you were mentioning that there is a problem in terms of getting foreign funds. So I'm trying to understand that let's say for IITs, there are certain sponsored research and industrial consultancy hubs where a lot of projects come. And what is the barrier here?
There's a certification that you need to get to accept foreign investments, and some institutes don't have that. That's it.
Okay. FRA compliance.
Yes, FRA is compliant. Foreign currency acceptance compliance is needed. Anybody can funnel money to our foundations. It's not easy.
Yeah, and especially considering that a lot of private universities are
Take this.
I like that DeSci allowed us to take less attention for governments, reports, bureaucracy, and all that obstacles from the past. That's in my experience stopped progress. Maybe not fully, but just as obstacles. And I'm just inspired from that maybe to go and to start air quality DAO and air pollution DAO, because it's a huge problem. And I don't want to wait for money from government. I don't want to wait from government when they fix it, because they cannot fix it, because they're thinking about their pockets or about wars or about I don't know what. So I think that decentralization, blockchain that allowed capital to flow from one pocket to another pocket, and in this case, I mean the people who want to have research on air quality, they can support my DAO to bring more people, bring more scientists, environmental scientists in our DAO to do this, initiate this research or another research. And I'm pretty inspired, but I'm biased, of course. I'm building in blockchain as well 2.5 years already. And I totally understand tradition concerns, because they here. But I think on some scales, we don't need it. Of course, it's a global project, medical, personal health, that try to implement some methodics in the hospitals and so on and so on. Maybe on that scale, you need to have a relationship and negotiation with governments and so on, right? But I think when we are on that step, then we have more resources and time to figure out that. So I think that this side helps on this level for scientists, independent scientists, to start, to kickstart, to initiate, and to deliver something that's important for public, for individuals, for this or another small groups. And thank you so much.
So I think the point is covered quite well. Yeah. So the easiest way to move money, especially given that government actually keeps a very tight check where the money is coming from, academic institutions have the liberty to actually take money in various different forms. One of the easiest ways would be to set up a foundation, a DeSci foundation out in US, which can actually give money through a sub-office out here, which actually gives the money to various universities. In that case, it's an agreement between an Indian subsidiary sitting in India, which actually does agreement with most of the universities and institutes. And the parent organization is a foundation based out of the US, which takes money. So, but it still needs you basically sitting on corpus of money, which gets funneled through a partner or a subsidiary office in India.
I also wanted to add that some of these things you mentioned, and some of the villages, we've been calling them under the umbrella of legal engineering, which is like this novel way of thinking about legal frameworks and engineering, which would help make such some arrangements as possible.
So
invited feedback. At the beginning, and you said it on Wednesday as well, you mentioned that open science and meta research are precursors to decentralized science. And I guess I want to caution that attitude because having come from open science and meta research, I see both of those as ongoing processes and principles. Meta research is inescapable. If we develop a decentralized system, we need to do science on that system, and that's the definition of meta research. So it's not a precursor. And I guess the reason I'm bringing it up is because being still involved with those communities, I see a lot of resistance to decentralized science. Now personally, I also see that it is offering potential solutions to scalability, citizen science in ways that traditional mechanisms are not. But there is an ongoing movement of 30 years or more that has been trying to solve this problem. And make no mistake, we have had better technologies, far better technologies than the journal system for a very long time. But yet we are still using the journal system. And so I guess what I would suggest is that our core problem is not one of technology, although I think DeSci can solve many of the problems we have. The core problem is one of culture. And if the DeSci movement positions itself as separate to traditional science, as separate to open science and meta research, I think it's actually creating a barrier because all of those open scientists are just going to have this allergic reaction to this new gang of people that think they're coming along and solving a lot of these problems, you know? So I guess that's just a piece of feedback that I think, even this debate, you know, traditional science versus DeSci, there needs to be an integrated approach.
By precursor, I mean like the inspirations were taken from open science and meta science, but it's just a different field. But again, like working close or with people from open science and meta science, that's how I see like people from open science still work with DeSci. These are like, how would I say? These are all integral parts of ways to advance science and all together. DeSci just solves this funding angle of things like funding and publishing, but open science also does something close to it. It's not to like create a barrier, but just to credit that we are not the ones who invented it. There were people who invented it, and we are just following their footsteps because on top of this. Yeah.
I want to add on top of that integration of or a dialogue between the two is very well needed, and to understand both of the systems is also extremely important. This is one of the conversations that I keep having with. So on community calls for research hub, we keep having a discussion around how to get more and more scientists onto the platform. And so you need to understand what kind of barriers they have in their regular business. So if they are crypto averse or they think, oh my god, earning in crypto is something, how is it going to affect my country has XYZ laws? So you need to think from those perspectives and make it easier for them to also come onto the platform. Or traditional scientists to think that this is another way of getting funding, or open publishing is something that I should be thinking about. I think for a long time you've been conditioned to think that this is the only way, while everybody does not like that current way. But there's no alternative path for them to go towards. So having that dialogue is extremely important.
One point here. So I think it's an interesting discussion all we are having is how do we get money to the Indian system. So in the last few, I presume in the last government regime, which is running for multiple seasons now, we have seen some very interesting things happening, which is the academic industry collaboration has actually become a heart of a lot of new science which has been done. Now the easiest way would be to mobilize money is that you get the money for projects and you mandate the academia must have an industry collaborator. Now, the moment you do that, you actually allow industry to absorb funds in various forms. For example, let's say I have a project which I'm interested in. You also want to see it translate into something reasonable, something which goes out to the public. Because otherwise I will be very happy studying dumb beetles, which nobody cares too much about. But if I really want to make sense out of it, I get an industry. Somebody sees a product coming out of that idea. So that means there's a potential productization. And you collaborate with that company and you pitch that idea through a DAO. And you raise that money which goes to the company. And since I'm already associated with the company, I can use that fund. A certain aspect of the project would actually result into generation of data which is public, people can access it. But again, once the idea gets translated into something which is a product, then that's an IP between the company, the PI, and the funders. So that arrangement is definitely workable, and that would be easy. So rather than funding pure academic research, which is very difficult to funnel money, start with an idea where you integrate academia industry and support only those ideas where you can see that there is going to be something which is coming out. And that will really ease out the movement of money.
So what we have done with, so we have applied the same model when citizen scientists come in, like as individuals. We need entity to channel funding. So we asked them to create a startup on their name, like as individual or whatever, LLC or whatever, and then we'll transfer this funds to the LLC. They can get a lab and then they can work on this. So I think this model, if that sounds reasonable for Indian ecosystem, I think we have already tried that. And some projects which got funded went on to spin out as a startup with this model. So there is Vita RNA, Vita Fast, which have become a startup, full functioning startup now.
Actually, that might be the easiest way because it's encouraged by the government.
Yes, all right.
Okay. And the legal aspect is now the company's responsibility. So the university goes out of the picture because university has already done an agreement with the PI or the investigator, and they have actually washed their hands off. What happens afterwards is the company's responsibility. So it becomes much easier to handle.
I also wanted to add that there are new efforts in this space that are trying to combine research into something that can become a product, which can also be a public good. That's one of the things that we wrote on this whiteboard as well. They're now called Focused Research Organization, sort of pioneered by a Convergent Research Group based in the UK. I guess we can share some links on the Telegram channel for everybody.
I have a targeted question now for maybe Deepak, you can take it. So a lot of times I get asked this question that if you're going towards open science and open publishing, let's say publishing on platforms like Research Hub, and you've got funding from traditional government bodies who have funded your projects, and they expect a publication to come out of it. And if you're publishing on open science platforms, which are new, fairly disruptive, trying to change the game where you don't have your traditional metrics of impact factor and all of those things. What kind of, I mean, I know you don't know what they'll react like, but what do you anticipate could be a challenge in that scenario for scientists to adopt some of these platforms?
I mean, you said it yourself, there are challenges. I mean, if the matrices of measurement of project is based on the publication record, and you publish in some obscure journal which nobody wants to acknowledge, you have basically failed in your science.
In the eyes of the government, right?
In the eyes of the government, but you know, when you say government, who's the government? Your peers, who's basically reviewing your grants, your papers. It's your own community. So the easiest way to overcome this barrier is increase visibility of such an effort in academic community. We are gathering here. I mean, this is an exclusive location. We have select audience who are interested in this. A majority of academic community is not aware, I mean, I'm putting in bold capital underline, not aware of this type of initiative where there is something called open publication, open funding, or open science. We are not aware. If we are not aware, we are not going to acknowledge it. We are not going to acknowledge its existence also, because these matrices of measurement of success, which you define here, are not our matrices from academic community. So if you really want this to get into the central thought process, your footprint is needed in academic environment, where you actually reach out to universities, education institutions, and talk about these aspects. Maybe as a seminar, as a panel discussion, let people give you pros and cons of this thought. But what you need to do is get this idea in the thought process of the investigator, the PIs, the scientists, that such a thing does exist. So remember, the PLOS journals, which was supposed to be open, it started as a crazy idea. It's gone mainstream now. It still has an impact factor, it was not supposed to have. eLife started, it has gone mainstream, it's trying to come up. So experiments keep getting done, they keep getting clobbered, they keep dying, and they keep joining the mainstream. But it doesn't prevent you from starting it, and people keep starting again and again. But again, the idea is that how do you seed this thought in the academic mindset? You got to do that.
Yeah.
You know, if it stays in this room, I know it, he knows it, we're the two flag bearer of the academic world, we'll probably go back and forget about it. Because we have a much larger pool of investigators who does not want to endorse that idea. It'll be almost,
basically find frameworks to avoid becoming mainstream.
Nature published a paper on
Yeah.
Research Hub Foundation, like Research Hub and DeSci and DAOs.
Yeah, so why did they, if you just want to look at that article, was it published because they want to champion it or they want to publish it because of an anomaly?
Yeah.
Anomalies does get published,
Yes.
right? So
That's
you're
what-
publishing an anomaly, you're publishing a black hole, nobody wants to talk about
It's
it.
more like a satirical
Absolutely.
publication.
Yeah, if
You
you
might,
read it.
if you want it to the mainstream, you need to do some sort of a concerted effort in reaching to the mainstream people whom you want to endorse onto your house.
Yeah, I mean, so every new idea probably has
Channels.
the early adopters,
Yeah.
and you want to find enough number of these early
Yes.
adopters.
And
to
some of the early
talk to
adopters
them.
like us are outliers, by the way. We don't
But
go
Swami,
anywhere.
there is a new 2024.
Can we discuss channels as well? Sorry to interrupt. Like, can we like focus on the channels to take it mainstream? Like,
Yes,
that's
so,
what I
so
would.
this is a main issue because it's going to help, what you guys are doing. So there is a new regulation, minimum qualification for appointment and promotion as UGC has just put as a draft, and I was one of the member. There is for the matrix of promotion, impact factor is gone.
Okay.
There's nothing for impact factor. We are not going to evaluate it for promotion and appointment based on where we have published. So that thing is gone. Now it's being left on the experts who are going to be peer review person, whose peers are who are going to review us. So that's the one thing. There is a component has been added. If you have started your startup as a one of the matrix for the appointment. So there is a 9 matrix we have put in there. There is a 1 matrix which is for the startup. If you have started a startup and got some kind of a funding, that's as good as you are publishing in a Nature Science or any big journal. So this is a 2024 regulation. It's as a draft. You guys can go read it, give your feedback. Within a couple of a week, it will be as a regulation. So this is the reason why I said new leadership in the UGC is very progressive. You need to integrate with the system. Take a top-down approach. It's going to work.
I think with this template, if you reach out to industry and reach out to the peer reviewers and enlighten them with such a possibility exists, things become easier.
Darshit, yeah.
Yeah, I think.
It's
I-
can't hear you.
Hello.
Yeah, no.
Yeah, so I had a layered question, but I think I'll put it through an example that we are going through as a startup to help me get a better insight. So I think this is a conversation Dragan and I had with our advisor as well from US. So we have something coming up in microbiome methods paper on how to analyze microbiome from start to end, right? Now we are in a fix because what happens is that as a startup, when we are trying to go through the TradSci publication, right? First of all, we need intense amount of good names on the paper authors, right? Which as a young company we usually don't have, right? That's the first challenge. Secondly, even if I go for a TradSci publication, I don't know, the peer review is going to go for another 12 to 18 months. By that time, as a startup, it's very difficult to use that technology and go to an academic institution and strike a collaboration, right? Now, instead of that, let's say I go through the DeSci route and let's say I publish on something like a research hub, then is there a problem? I mean, there is a problem that the academic institutions are not going to respect it as much as the nature cell or science. So what does a startup which is a lot more focused on R&D would do at a point like this, right? I do understand that there are bio-RxIV's framework, but I still think that at least Research Hub has some kind of peer review. Bio-RxIV has no peer review. So where really the value for us lies in that case?
Yeah, so I see the layers in your question. what Research Hub also does is takes the archive papers and then puts it on their platform, and then they undergo peer review. So you can take that route as well. You put your paper on archive, where you can say that our paper is now a preprint on archive, which is a more acceptable format. At one point, people were not accepting archive as well, right? But now it has gone into the mainstream, where people acknowledge that, okay, the preprint is out there and people can read it. And then that preprint can come to Research Hub, where it can get peer reviewed, and you can use that to show it to people. Beyond that, you can decide which route you want to go, the Research Hub journal, or you want to go a traditional journal. But in terms of the academia accepting your research or not, I always feel like if you show your results and your data to a scientist, a lot of times they don't need a publication to see whether the research is good enough or not. So I would quote Yash in saying that that's your mimetic gatekeeping, which is stopping you from publishing in either of these open science platforms. I understand that you want to use it in fundraising, but if you rewire yourself to genuinely say that, okay, this is going to be something that is going to have our name on it as the ones who did it the first time. And there's enough amount of marketing that people do these days for their science. And I see it with people who do it with their nature papers or any other papers or research papers as well. So it's about how well you can get people to use the technology that you have developed into their applications. And then they go back to people and tell them this is something that EcoH developed and we've been using it. I feel like there are multiple things which are broken in that entire pipeline right now. But you have to find what's the best outcome that works for you.
I also just
yeah, please.
I can also just add to that. So, kind of like what I was saying before, there's lots of technologies that have been around for a long time and are probably more palatable to an academic institution. So, if I don't know what the cultural situation is with the institutions that you're talking to, but there's various platforms like PubPeer, pre-review that will allow people to review preprints, and preprints themselves, especially since COVID, have become more of an established norm for kind of setting precedents. So it might be that those kinds of avenues that are more traditional but more recognised within academia might be seen as a more legitimate form of peer review. And I don't think they're antagonistic to Research Hub. You could get it reviewed on both. But maybe if you're trying to find those kinds of partnerships, speaking the language that those institutes are interested in might be useful.
Yeah, so I have one last question in the interest of time for Deepak and Professor Pesh who wants to chime in on that, or anybody in the room. What do you think is going to be, do you think it makes sense to start a bio-DAO for accelerating some of these scientific research in India, where we can focus it towards the Indian scientific ecosystem? We can have participants who can help build, propagate it forward. I know it looks like alien language right now, but what do you think is the potential of the principles on which these bio-DAOs are built, and do you think we can find those early adopters who can make it a big thing? Because that's how any new technology comes up.
I'll take that. It's a question simple. Should we do the experiment? The answer is yes. Whether they succeed or not, we have no idea. Right? So BLAST was one experiment which was started. Let's get rid of impact factor. Let's make a public library of science, which is what PLO stands for. Let's have a bunch of journals people publish, charge a nominal fee. We get peers to review on our, let's see where the BLAST stands, still has an impact factor. It is actually a very traditional journal. Nothing's public library open science about it. It's a very, very traditional journal. It's an experiment which failed, but it's an experiment worth trying to set up a whole panel of journals where people have new platforms to publish. Now, we have no idea how the DAOs are going to turn out in the long run. My major concern, coming from an academic background, is who's going to review my proposals? Why? If I happen to be somebody who's got gift of gab, if I'm somebody who can, demystify science easily, or if I'm doing something which catches the catchwords of the day better than the others, I will get fined. Like, if I say I want to write a grant on, my favorite phrase is dung beetles and how they degrade the dung, I'm not going to get funded. But if I say, I'm going to look for beetle which degrade the dung and bio-waste and get rid of the pollutants, I get funded. I pretty much do the same project. I still look at my dung beetles. So, problem is, who's going to review that? Am I going to project the image which the funders want to hear from me? Or I'm going to project what I want to do? And there's a disconnect in it. And we all accept in the scientific fraternity that the more technical your science is, the less chance of it's going to get through public domain, but more chance of getting it funded through scientific domain. Our guys who review grant, they want to see methods, protocols, great detail of statistical analysis. The n is equal to 1 Brian Johnson is not acceptable. Not in scientific community. We just cannot get even one dime to these experiments. So that's a problem which we run. So how are we going to control an ecosystem of funding from those who have gift of gab but have poor science backing it, from those who got good science but they do not have the expressive skills which is needed to convince people to fund them? Are we going to a vicious cycle where you fund bad projects, come back and get our favorite notorious old gas bags at the review committee, and they will still reviewing the good science from the viewpoint of certain people who have achieved certain success in science? We are back to the same traditional trajectory. How are you going to solve that problem? Still says. I like the idea of DScience. I like the idea that you get funding. I like the idea you get funding for crazy ideas. I like the funding you don't have to get into the red tapeism of trying to convince people to fund me. I get continuous support, I get flexibility. There are many bads in modern science as of now. But is it going to solve all those bads? I'll leave the question open to anybody and everybody to comment.
Just to add a point, sort of what you're saying is that how to choose the right people in these DAOs, right?
Absolutely. Yeah. If you have a big pocket, do you want to push your agenda?
I just want to give an overview of what's good and bad in DAOs. The good is you have multiple communities here, like let's say we fix hair loss as an agenda for this DAO. We are gonna approve these proposals based on what the community wants. Like community wants to see translatable solutions that solve their problems. So these proposals are gonna get passed. And who's gonna judge these projects is again a scientific community that these DAOs recruit as like Suramya is there, like working for Athena DAO. So they bring in scientific leads to de-risk the project, saying that look at these experiments, like we might wanna rethink about this. And then also like bringing inputs from the end users, like what is relevant and what not is relevant, right? So this is a kind of de-risking that can happen for the project itself. And so who holds the control of these DAOs, right? That's a big question. At the moment, it's a governance problem. It's highly centralized. There are big whales who can influence these decisions. And that is something that we want to like actively change for a robust governance model. And that's been also one of the problems that are raised for Zu-grama community to solve. You know, there is a governance issue within these DAOs. Yeah, that's the good and bad side. And then now she can tell more about like how the research community works. Right?
Yeah, so part of what the deal flow does at the DAO is to first of all scout the right projects. So we don't just put out a call and wait for people to submit their proposals. Each one of us who are in the deal flow actively goes out on a hunt, puts together a CRM of 400 to 500 people across the world who are even remotely working in the topic that we have chosen. For example, let me take an example of gynecological oncology cohort that we did. So there are people decentralized in the deal flow in different countries. Let's say there were 3 people from India who were in the deal flow at that time when we were working. So we divided it across North India, South India, West India, all of these things, and then we hunted every university and went through the list of people who are working on this stuff. So we bring them to our CRM so that they have one level of visibility saying that okay, these are the people working in the field. After that, we put out emails to them, try to reach all of them. I've had calls from people all across India trying to tell them about this is a new funding model. As a result, we've also had about 10 to 12 projects that came from India in that cohort. After that, you have the entire deal flow, evaluate these projects because there are people with different expertise. And when we enter the deal flow, we list out what set of expertise we come in with. After the deal flow goes through that screening process to say that okay, this is a scientifically sound project or not, we then move on to senior reviews. These senior reviews are also chosen, decentralized all across the world from different countries based on how they have, which domain they have expertise in. So for example, we do it for every cohort, we change the reviewers and choose them basically based on the project topics. Once the deal flow has approved, the senior review has approved, and given a certain amount of credibility that there is in the project, it goes to a community vote that he said, and then the community decides that okay, gynecological oncology is something that I want to fund, but out of 5 projects, these 3 make the most sense out of me. And now in between these process, we make the science more accessible to the community so that they don't have to read through all of the scientific jargon that they may not understand, but we simplify it in terms that is better appealing to them, right? So for the point that you mentioned, to the people who cannot communicate the science very well, we interface between the deal flow and the community to then help bridge that gap better. And then it goes through a community vote, it gets funded.
Hold on.
Yes.
So now I'll tell you what is the traditional science funding protocol looks like. We have open call. Project gets submitted. It gets reviewed by a bunch of anonymous reviewers. It goes to a technical committee, which sits together, looks at the review for each grant, gives it a scoring, and it goes to the funding agency, who then looks at which one of the funding agents are. None sounds different from what you just mentioned. It's the same mechanism. The problem comes is the fairness of the review process. And the challenge is very, very simple in traditional science. I'm just playing devil's advocate here. When you see quality review from trained people, and let me give you a very simple example. Right now I'm sitting with some agency proposal. I've got 45 proposals on my dashboard, and I need to review them by Monday. Not humanly possible, all right? So I'm going to spend how much time? About 3 to 5 minutes per proposal. Am I doing justice? Absolutely not. And why does that happen? 90% of the people who are asked to review turn it down for lack of time. You end up sending proposals to the same people who end up reviewing. You're looking at stating the same flaw which we are currently facing. How are you going to resolve that flaw? Where are you going to get quality reviews for proposals? How are you going to get the sanctity of the reviews? I end up getting proposals to review from my friends. So they submit a grant, they put my name, they come to me. And what do? I say, yes, I will review.
Yeah, so then that's where the incentive mechanism comes in inside the DAO for the entire deal flow review process and the community, where all of these reviewers who agree to do, let's say, 5 reviews, there's an incentive attached next to it for quality review.
Problem here again.
So,
incentive, as an academic and government institution, we cannot take incentives.
But you can take it, you should take it, yeah, like you're.
Well, it's not should, the
lending
government
your time.
prohibits from us.
We
from
cannot.
taking it.
But
So
you know,
that's why we
another-
have an alternative mechanism, right? So one thing I wanted to add was, yes, it does sound very familiar to TradSci, the way it is structured currently, mainly because we are still iterating on what governance mechanisms we can actually build. Because reaching consensus versus reaching impact and truth seeking are 2 different things, and we don't know how to do that efficiently. And second thing I wanted to say was, what this crypto economics does is it gives you a method to have regenerative finance in some way. So imagine if the Nobel Prize winners for AI could actually get a stake from OpenAI, right? So you needed to track all the way from their research to this product, and that can happen through tokens that you can give out during initial research, such as you can call it any tokens, right? So I think this behavior somehow makes people more truth-seeking. One example which I like to give always, which I was very surprised, is GK is here. Me and him are working on this AND protocol thing, which is like, if you see what happened with Polymarket, it was a very simple mechanism which said if you had people put skin in the game, they somehow make efficient decisions. So if you were to lose money or gain money, people behave very well for some reason. And we saw that with the Kamala versus Trump thing, where Polymarket became a very big thing, which is built on crypto rates.
So, my question is regarding when you are scouting, person who is going to, scientists who are going to apply for these grants. Problem is how it's democratized scouting is. What is your, what is your parameters, whom you are approaching? Is it only IITs and ISCs? Are, looking at to the, what are the metrics? How you are going to identify that this person is capable of executing a problem? So there's a two-step. One is idea, and another is execution.
You know about the bias problem, right? So that's how you choose the right people who do the right scouting is the problem. So I mean, I can answer for myself where I list out all of the universities across the tier 1, 2, 3, 4, private to government, and everybody who's working in the field, because at the end of the day, it's science and the project that you're doing, and whether you're capable of doing it or not. But again, there should be a mechanism. Right now, we have to do the scouting because we don't have penetration enough for people to come to us. So we have to go to them. So in some way, we are reliant on us finding these people and then getting them in to apply for these funding grants. But when you have that penetration, you will have people coming in with their project and their ideas. So the elimination of which university you belong to and all of these things goes out. Like we have projects funded from Portugal, Spain, different universities which are not very top tier universities, but the science is very good, which were not getting funded earlier in traditional science ecosystems.
So you decide how they are good based on their publication or?
No, you have to go through the research papers and actually see what kind of projects they've done, the gynecological oncology that you are putting out, let's say, does it match? Do the ideas even match to what is an advancement in the field, right? If somebody is taking the same molecule and doing some similar science of testing it in another compound, I don't know, does it count as an advancement of pushing the boundaries of the field or not? So those kind of decisions is what the deal flow currently has to make.
Yeah, so I think Scott raised a very important point here. If you really want this model to succeed, what I would suggest is disconnect the two, the science from the individual, review them independently. You do not have to review the science with an individual. You first look at the competence of the individual, which is done by one set of reviewers who do not know what proposal has been proposed. And then second set of reviews done by on the science, which is dissociated from the proposal. We do not get to know the identity of the individual, but you get to know the credentials to a certain extent without revealing the name that it's a guy is a clinician or person is a clinician, have done research in a private or public funded institution, and then you review it. The second part of the review, which is the toughest part of an academic review, is the feedback from the review. It's generally very vague, and when we give the grant and it doesn't get funded, we look for feedback from the reviewer. And most of them it's crappy as, I don't want to use the word, but it's really bad because you don't know how to get feedback. We just get one comment, not satisfactory. Of course it's not satisfactory, and your review is also not satisfactory to me because it's telling me nothing. So it might be easy to have a review which you have clear points mentioned. Is the idea novel? Is the novelty addressed sufficiently? Is there a market table? So I think some sort of a checklist.
Also, to that point, what we do is when we have applications out, like for example, I tag myself to 5 different projects that have come in, and then when I go through the application, I have the liberty of going back to the scientist and asking, hey, I did not understand this in your application, can you please mention this one? I've done that personally with 5 different
projects. That's something a pre-screen check, so there has to be multiple layers of features.
An iterative process of getting more and more questions and pushing them to get more answers so that you have a better understanding of how they are thinking of the project instead of just reading through it and saying reject, accept. That's what we currently are
within this mechanism, we can also have a discourse being enabled between reviewers and people who are proposing the project. I think because of the nature of this incentive mechanism, you can build that into the system itself. And this, as the skin in the game property, which I mentioned, generally comes from broadly crypto speculation, right? And if you see some very interesting projects, even in PCIs, yesterday I was mentioning about open water, it was actually funded through crypto speculation itself, which is the skin in the game factor for some reason seems to have this behavior where people would want to support these kind of things. So it's a novel thing. There are still improvement, but I think the crypto economics layer can actually help solve some of these things. But as you pointed out, it's still in the experimental phase, and we do not want it to look like the traditional problems reinvented in a different way.
I guess, democratization of this process, along with the decentralization, is going to make it more attractive to scientific community.
Yeah. It's
And-
not democratic
Yes.
enough at the
Yeah,
moment.
and
It's
you
very
know,
centralized at the moment. We agree.
yes.
It's a
So
bad
I think
governance.
both we need to bring together, and we need to also, communicate to the scientific society. I have a colleagues, they always talk about, let's do the crowdfunding for this project. In the US, they do have a regulation, you can generate a funding using, crowdfunding, but in India, we don't have that mechanism. So I think this kind of a thing, if we popularize it, go to the universities, bring the scientists on the board, tell them, probably we have a better chance of success.
I think just last few comments. So you talk about skin in the game. The skin in the game is a very dangerous thing. And I think some of us academicians have seen it firsthand. When a reviewer wants you to do what they want you to do. And that is really drives, I've had issues with reviewers who want us to change the titles. I have put my foot down, I'm not going to change it. And they say, no, we would like, otherwise I'm not going to do it. I will not recommend your paper, your grant. That scheme is a very dangerous game because you end up getting up people having saying something where they are not going to be the implementing person or they're not going to benefit or generate anything. So there has to be a scheme, but there has to be moderated by somebody who know that you're crossing the certain boundaries. That's one. Second part, you talk about democratization. Risky word in a country when you have 1.3 billion people. You're going to get overwhelmed. Right now, in any funding call our government receives, we receive thousands of applications. Thousands, literally thousands. Even if the grants are like peanuts, we get many thousands. What happens? If you have thousands, you don't do justice to any. You're basically doing a herd review. Oh, X university, X grant, X amount of money, triangulation is not fitting, reject. X amount of money, this university, grant looks good, fine. Am I looking at science? I don't not do that justice at all. So yes, democratization sounds good, but the easiest model would be that if you have a good team in the back end, get specific calls on a particular theme, let the core committee review it, dissociate the person and the grant, get them independent reviewed, and then you might start small, but the chance of success might be better.
Yeah, the second part I totally agree. I don't think we have that figured out as well. But regarding the skin in the game, I meant more like, if we find out behaviors of any reviewer which is not ethical, you can actually take out their skin, right? So you can cut their reputation or cut their incentives in whatever manner, which might be possible. So because of that, emergence behavior, you can have people sort of behave well.
That was sort of like what research I was
Right.
talking about yesterday.
Well, we need to think sometimes behavior is unintentional too.
So
And if you will do the reputation kind of a thing, a lot of people will not come in there. One example will say, and scientific community, especially academicians, they are very careful about that. One that kind of a thing will ruin this, nobody will join.
that's a good thing. Right?
So no, but the thing is, it will discourage other people to join your group for the review purpose. And most of the time, problem with publication is not getting a good reviewers. I am an associate editor for 3 journals. When I have to solicit a reviewer, it takes a month. Sometimes I have to call my friends and say, hey, please accept this review.
Can I just quickly finish this review part, which you guys mentioned? So how does a review happens within a DAO is, or DAO or for these ESET projects, we have a framework on how to review and what all answers should be added here. So there is, so any reviewer who is reviewing for this project has to go through this extensive framework to review a project. And this is blinded. So no one knows who is the other reviewer, so we'll select like randomly 3 reviewers out of the domain, and then they all have to give review based on this. So you have to like explain therapeutic relevance and mechanism of action for this project, why they think this is the score for relevance of the therapeutic relevance is so and so. So they have to also attach papers and their thoughts attached to it. And so there is a 10 different sections that they have to fill in, utility of candidates. So there are different questions that they have to go through. That's why we have incentives, because it's a work that you have to do. Like it really takes a lot of time to go through this. But again, with the democratization angle, does anyone go and read into this? It's highly questionable. Some people they don't even want to like read this. This is basically the risk document. What is the risk associated with funding a science project? Not only a lot of people want to go and read through this, but we just make sure they can make an informed decision whether to fund or not fund. So I think these frameworks kind of helps, but again, like these has to be reiterated, what works for what's a project. The whole DAOs movement was to connect the community and the science. Let's say like, okay, there is a group like which wants to participate with the science process, like who kind of consumes these scientific products. Are we aligned to these sort of people like who wants to consume this product? Like, are we developing solutions for them? Are we just trying to create a product and then find a market which can consume this product? The idea is to bring all of them close together in a community, let them have a dialogue and see like what is the burning problem for this community and how can we bring this to, how can we develop a product for this? So that's how like hair loss came in. Like they did citizen science projects, like they tested the new products that they developed on themselves. And they launched 2 shampoos. They have 6 patents which are like into this hair loss research. So it's way accelerated, it's very decentralized. There is no regulation, like less regulation involved. Again, there are questions. Like we need to be answered. Like how will you ensure that safety of the users and all of this? It's all done in scientific setup. Like minimum regulations are met, but it's way more accelerated than we are seeing now. It's quite possible in some of the areas like where. But I think for Indian context, there should be a lot of new discourse that should be happening to understand DAOs in its true self. And I think one point that I agree with you is the top-down approach, going through these funding agencies, because you can make DAO more mainstream and then onboard more scientists, also onboard more community members like patient groups who've been fighting for, let's say take rare diseases. Like no pharma would come and invent a solution for rare diseases because the capital is not that good. Like you cannot find a market for it. So in such cases, there is another DAO which is taking 3,000 rare diseases altogether and then pooling up capital to invent solution for them. So I think we need to find local problems that align, that is essential for Indian context. And then from there, you can build bottom up and then also like top down to connect these 2 communities together. Yeah. And Jiku has a question.
It wasn't a question. I wanted to answer to this point about skin in the game. And I have actually discussed this in quite some extended capabilities. And I think what Yash has actually mentioned is also pretty interesting. So it actually looks like skin in the game can definitely corrupt the system. But when the number is actually very high, when the number of people who are participating is very high, their individual chances to corrupt actually goes down. So it's basically wisdom of the crowd. So I think if the number, there's a threshold obviously. If the threshold is beyond that, I think it can actually work really well. So just wanted to actually put that in.
All right, thank you so much. I think I've made down 2-pager notes on what all mechanisms we need to build and what to take care of. But I think it has to be an ongoing dialogue with people from traditional academia, and I think we need to stop calling it traditional versus DeSci, or just use scientists or academia, and then see how we can build a better model for people to accelerate science. Thank you so much. We'll I'll push the next session on Lemonade from 2 to 2:30 because it's already 1:30 right now. So we'll meet here again at 2:30. We'll have a session on women's and men's health by Dr. Samatha. And is Alicia here? No. Okay. Cool. Thank you.
How is it, how do you science